It's definitely time to get everybody off the ship now. One of the things that we've realized, though, in the last few days is that many of the infected passengers were not infected recently. They seem to have been infected a little while ago, maybe even as long as 2 weeks ago. And then it's just taken time to do all the testing and to be able to test all the passengers to know who might be infected. So it doesn't seem like the rumors that there was a lot of infection spreading in the last week. That doesn't seem to be the case. It seems like quarantining people in their rooms did stop onwards transmission. It's just that there was some kind of event earlier on the cruise ship which led to a large number of infections.
So that's counter to some of the other claims that we've heard about how the virus is spreading on board. As far as you're concerned, is isolation of people then enough to stop the spread? Because there were talks about it potentially spreading through the air conditioning on the ship.
Yeah, I've heard a lot of those rumors. I think we need to wait for the official report to see how this really did occur. Certainly, isolation of cases is important. What we've seen, though, with this coronavirus is that people may be able to spread a little bit before they have symptoms. And also, even some people without symptoms might be able to spread infection onwards. So those are two concerns which wouldn't be solved by isolation of ill people alone.
What about everybody getting off the ship? Because not all of the people getting off the Diamond Princess are going into quarantine. Is that the right decision?
I think we can certainly advise everybody who's got off the ship to go into home quarantine, maybe voluntary home quarantine. At least we know who these people are and the health authorities in their home countries know who they are. I'm a little bit more concerned about people that might have been infected that we don't know about and then have traveled. And so we'll only find out about those kind of cases after they go to hospital or after they spread infection onwards. So I'm more worried about silent cases in the community than I am about these particular travelers where the health authorities already know who they are.
And what could the repercussions be of those silent cases?
So if there were silent cases in other countries now, then we wouldn't know about it until there'd been a little bit of transmission. And then, maybe in days or weeks' time, we'd realize that there were these silent cases. That's what we're really trying to be alert for now, as much as possible, to pick up clusters of cases and then to stop chains of transmission. In Hong Kong, for example, we've had a number of cases. We don't know how they were infected. Presumably there were other infected persons first, and we never identified them, and they managed to pass infection on to the cases that we've subsequently identified.